What if the warning sign you've been ignoring wasn't in your chest at all? What if it was right there at the tips of your fingers, something you look at every single day? But nobody ever told you what it meant. Most people over 60 have noticed changes in their nails. Maybe they got thicker. Maybe they started curving. Maybe there are strange lines or a bluish tint or ridges that weren't there 10 years ago. And most people do exactly what most doctors never correct them for. They shrug it off. They think it's just age. But here's what most people don't realize. Your nails are not just dead keratin at the end of your fingers. They are a living window into what is happening deep inside your cardiovascular system. And for people over 60, some of those nail changes are your body sending out a quiet alarm. One that, if you know what to look for, could give you months or even years of warning before a serious heart event. Stay with me, because what you're about to learn could be the most important thing you watch this year. Cardiologists, doctors who specialize in the heart, are trained to look at your hands before they even look at your chest. This has been part of cardiac examination for over 100 years. Long before EKGs and ultrasounds existed, physicians read the body's surface, and the nails were always one of the first places they looked. The reason is simple. Your nails grow from living tissue fed entirely by tiny blood vessels, capillaries. When your heart and circulation aren't working properly, these tiny vessels are often the first ones affected. They're at the very ends of your circulatory system. Just like the pipes farthest from the water pump lose pressure first, your nail beds are often the first place where cardiovascular stress shows up visibly. This changes everything about how you look at your nails. They're not just cosmetic, they're diagnostic. And after 60, knowing what to look for could protect your life. The first sign is one that cardiologists call clubbing. Clubbing happens when the soft tissue just behind your nails begins to enlarge and puff up. The nail itself curves downward, almost like the back of a spoon. The angle between the nail and the skin at the base flattens out, or even reverses, so the nail appears to bend away from the finger. Here's what most people don't realize about clubbing. It develops slowly, over months or years. Most people who have it just think their nails have always looked that way. But clubbing that appears after the age of 50 or 60 is one of the most recognized signs of chronic low oxygen in the blood. And chronic low oxygen is directly connected to serious conditions including heart failure and long-standing lung disease. The real problem starts when oxygen delivery to the tissues breaks down gradually. Your body compensates, your tissues adapt, your nails change shape, and you never feel the exact moment it begins. If your nails have been curving more than usual, if the ends of your fingers feel fuller than they used to, do not ignore that. The second sign gets dismissed constantly. And it shouldn't be. Look at the color underneath your nails, not the nail itself. The skin below it, the nail bed. In a healthy person with good circulation, that area should be consistently pink and warm. If you see pale, whitish nail beds, sometimes called Terry's nails, this can be a sign of reduced blood flow. When the heart isn't pumping strongly enough, your body starts rationing blood. It pulls circulation away from the skin and fingers and sends it to the brain, lungs, and kidneys. This is a survival response, but it leaves your nail beds looking pale, washed out, even ghostly. Terry's nails, where most of the nail looks white with a narrow reddish band near the tip, have been associated in medical literature with heart failure, liver disease, and diabetes. What most people don't realize is this. If your nail beds used to look normal and now they look pale, that change is information. Your body is trying to warn you that something in your circulation has shifted. The third sign is the one most often overlooked entirely. Blue nails. A bluish or purplish tint to the nail beds or fingertips. The medical term is cyanosis. When your blood carries enough oxygen, it stays bright red. That's what gives skin its pink appearance. When the blood is not picking up enough oxygen, because the heart isn't circulating blood efficiently, or the lungs aren't working well, the blood turns darker, more bluish. And that color shows through the thin skin of your nail beds. In people over 60, persistent bluish nail coloring can be a sign of congestive heart failure, pulmonary hypertension, or chronic lung disease. And the frightening thing is that many people adapt to this change so slowly they stop noticing it. They look at their hands every day. The change happens gradually. Then, one day, a family member says, "Have your fingers always looked like that?" And they realize they don't know the answer. This is where the hidden damage begins. Not in one dramatic moment, but in slow changes nobody takes seriously until treatment becomes harder. The fourth sign involves what are called splinter hemorrhages. These are thin, dark lines. They look almost like tiny splinters trapped under the nail. Dark red or brownish, running lengthwise from the base toward the tip. Most people think they've injured themselves, and sometimes that's true. Minor trauma can cause them. But when they appear without injury, when you notice them on multiple fingers, or when they keep coming back, they can be a sign of infective endocarditis. This is an infection of the inner lining of the heart and its valves. The infection causes tiny clots in the bloodstream, and those clots block the small vessels under the nail bed, creating those characteristic dark streaks. What most people don't realize about infective endocarditis is that it doesn't always feel dramatic. In older adults, it can cause low-grade fatigue, mild fever that comes and goes, or just a vague sense of feeling unwell that's easy to blame on aging. And during that time, those little lines under your nails might be the clearest visible clue that something serious is happening inside. If you have unexplained splinter hemorrhages across multiple fingers without any hand injury, please see a doctor soon. The fifth sign is something most people think is just a nuisance: ridges. And here's the important distinction. There are two kinds, and they mean very different things. Vertical ridges running from the base to the tip of the nail are common with normal aging, and on their own are not alarming. Nail cell turnover slows down after 60, and mild vertical ridging is part of that. But horizontal ridges, grooves that run across the nail from side to side, are a different story entirely. These are called Beau's lines, and they are clinically significant. They form when nail growth temporarily stops during a period of extreme physiological stress, a serious illness, major surgery, or a cardiac event. Your nail essentially pauses during the crisis, and when it starts growing again, it leaves that groove behind like a scar in time. Here's what makes this so powerful. A Beau's line takes roughly 3 to 6 months to grow from the base to the middle of the nail. If you see a horizontal groove crossing your nail, look back 3 to 6 months. Something significant happened to your body around that time. Sometimes people discover it was a cardiac event they didn't fully recognize, a period of breathlessness they dismissed, or chest discomfort they thought was indigestion. Your nails remember what your mind tried to forget. Now let's understand why all of this gets so much worse after 60. Because this explains why you need to take these signs more seriously now than ever before. As we age, our arteries gradually stiffen. Young arteries are elastic. They expand when the heart pumps and spring back, helping push blood forward. Older, stiffer arteries force the heart to work harder. Blood pressure rises. The vessel walls develop inflammation, plaques begin to form, and blood flow to the extremities, including your nail beds, is often the first circulation to suffer. In women, estrogen has a protective effect on blood vessels throughout life. After menopause, that protection drops sharply. This is why women's cardiovascular risk climbs steeply in their 50s and 60s. Nail and circulatory changes in postmenopausal women deserve much closer attention than most people give them. Chronic low-grade inflammation, what scientists call inflammaging, accelerates these processes. The body produces more inflammatory signals as we age, even without infection or injury. This damages blood vessel linings, encourages clot formation, and impairs circulation to the small vessels in your nail beds in ways that become visible over time. All of these changes, stiffer arteries, hormonal shifts, accumulated inflammation, they all affect blood flow. And one of the first visible places you see it is in your nails. This is not coincidence. This is biology. Let me tell you about Margaret. Margaret is 67, active her whole life. Morning walks, afternoon gardening, no major health scares. But over 2 years, her energy had quietly faded. Climbing stairs left her slightly breathless. She blamed her age and a few extra pounds. Her doctor ran a routine EKG. It came back normal. She went home reassured. What Margaret hadn't mentioned, because she didn't think it was relevant, was that her nails had been changing. More curved than before. Nail beds paler than she remembered. And occasionally, little dark lines under a few nails she couldn't explain. She mentioned this to her daughter almost as an afterthought. Her daughter looked carefully at her mother's hands and said, "Mom, go back to your doctor, and specifically show them your nails." Margaret felt a little silly doing it, but she went back. This time she showed her doctor her hands and described the changes. The doctor ordered a more thorough workup, an echocardiogram and additional blood tests. What came back was significant. Margaret had early-stage heart failure. Specifically, her heart's ability to relax between beats had become impaired, not catastrophic, but real, and caught early enough that medication adjustments and lifestyle changes could significantly slow its progression. Margaret still walks her dog every morning, and she looks at her nails differently now. Here's a simple test you can do right now before this video ends. It's called the Schamroth Window Test. Doctors have used it for decades to check for nail clubbing. Hold both hands in front of you. Bend your index fingers on both hands so the nails face each other. Now press the two nails together, back to back. Look at the space between the nail bases where they meet. In a person with healthy, non-clubbed nails, you'll see a small diamond-shaped gap of light between the two bases. A tiny window. In someone with clubbing, that gap disappears completely. The nail bases press flush together with no window at all. Try it right now. If you don't see that small diamond gap, if the bases press flat with no space between them, mention it to your doctor. It's not a diagnosis, but it warrants a proper cardiovascular evaluation. Also, press gently on your fingernail tip until it turns white, then release it. Watch how quickly the color returns. In healthy circulation, pink returns within about 2 seconds. This is called capillary refill time. If it takes noticeably longer, that's worth discussing with a doctor. Now let's talk about what you can actually do, because this is not about fear, it's about action. Start with what you eat. The most important dietary change for your heart after 60 is reducing chronic inflammation. Cut back on refined carbohydrates, processed foods, and excess sugar. Replace them with anti-inflammatory whole foods. Specifically, eat more oily fish like sardines, mackerel, and salmon. These are rich in omega-3 fatty acids that reduce inflammation and improve the flexibility of your blood vessel walls. They also contain CoQ10, a compound the heart muscle uses directly as fuel. After 60, the body's CoQ10 production declines. Ask your doctor whether supplementation makes sense for you. Eat leafy greens every day: spinach, kale, arugula. These are rich in dietary nitrates, which the body converts into nitric oxide, a molecule that relaxes and widens blood vessels, directly improving circulation to the extremities. Research has shown this can measurably improve blood flow within weeks. Add beets. Beetroot is one of the richest sources of nitrates available. Fresh beets, beet juice, beet powder in a smoothie. These are practical, inexpensive ways to feed your circulation daily. Reduce sodium and stay well hydrated with plain water. Dehydration thickens the blood and makes the heart work harder to circulate it, which directly worsens nail bed blood flow. For movement, the single best exercise for cardiovascular health at this age is consistent, purposeful walking. Not a casual stroll, but a pace where you feel slightly breathless but can still hold a conversation. 30 minutes most days of the week. Here's what most people don't realize. When your leg muscles contract during walking, they physically squeeze the veins and push blood back up toward the heart. This is called the muscle pump. When people become sedentary, this pump weakens, blood pools in the lower extremities, and the heart has to strain to pull it back up. Circulation to the arms and hands suffers as a result. Simply walking every day, consistently, purposefully, is one of the most powerful things you can do to improve peripheral circulation and restore better blood supply to those nail beds. Also, protect your sleep. During deep sleep, your blood pressure drops, your heart rate slows, and your cardiovascular system repairs itself. Inflammatory markers decrease. Blood vessels heal. When sleep is consistently poor, especially from undiagnosed sleep apnea, the heart never fully recovers. Morning blood pressure stays elevated. Inflammation doesn't resolve. If you snore loudly, wake up unrefreshed, or your partner has noticed you stop breathing during sleep, please talk to your doctor about a sleep study. Sleep apnea is one of the most underdiagnosed contributors to cardiovascular disease in people over 60. And finally, manage your stress. When stress hormones are chronically elevated, blood vessels stay constricted, especially in the extremities. Your nail beds get less blood. Over years, this contributes to real cardiovascular damage. Find what genuinely reduces your stress: daily walks, time in a garden, connection with people you love, And protect that habit as seriously as you protect your medications. Here's what a realistic timeline looks like when you start making these changes. In the first 2 weeks, the changes are mostly internal. Nitric oxide levels start improving. Inflammation begins to come down. You probably won't see nail changes yet. Nails grow slowly, but your circulation is already shifting. Between weeks 2 and 6, many people notice their hands feel warmer. The bluish tint in nail beds may lessen slightly. Capillary refill time speeds up. Energy improves. Resting heart rate may drop a little. Between 1 and 3 months, nail bed color often visibly improves. Blood pressure, if elevated, often comes down measurably. Breathlessness that was persistent may ease because the heart is working more efficiently. Over 6 months to a year, with consistent habits and proper medical care working together, many of the visible signs of poor peripheral circulation can genuinely reverse. Your body has a remarkable capacity to respond when you give it the right conditions. This is not wishful thinking. This is how human physiology works. Now I need to say this clearly. Nothing in this video replaces medical evaluation. If you look at your hands right now and you see clubbing, significant blue discoloration, multiple unexplained splinter hemorrhages, or nail changes you don't recognize, please see a doctor. Not next month. Soon. Cardiovascular disease is the leading cause of death in people over 60, but it is also one of the most treatable conditions in medicine when it is caught early. The treatments available today are extraordinary. People are living full, active lives into their 80s and 90s with heart conditions that once would have been devastating because they were found early. Talk to your doctor specifically about cardiovascular risk assessment. Show them your hands. Ask about an echocardiogram if you haven't had one. Ask whether a cardiologist referral makes sense for your situation. You are your own best health advocate. The more informed you are, the better questions you can ask. And the better questions you ask, the earlier anything important gets found. Let's bring this full circle. You started this video thinking about nails, maybe something you noticed on your own hands, maybe just curiosity, but what you've actually learned today is something much larger. You've learned that your body is always communicating with you, that the nails, those 10 small panels you see every day, are quietly broadcasting information about your heart, your vessels, your oxygen levels, and your immune response. You've learned the 5 signs to watch: the curved, clubbed nails, the pale or white nail beds, the bluish tint of cyanosis, the unexplained splinter lines, the horizontal Beau's lines that mark a moment your body was in crisis. You've learned a 30-second test you can do at home right now. And you've learned what to do: walk, eat the greens and the oily fish and the beets, hydrate, sleep, manage your stress, and above all, see your doctor and make sure they know what you've noticed. The warning in the title of this video is real, but it is not meant to frighten you. It's meant to give you time to act, time to ask the right questions, time to give your body the support it has been waiting for. Take care of your heart. It has been taking care of you your entire life. And the next time you look at your hands, really look at them. Your body has been sending you messages. Now you know how to read them.